So this webinar is Coaching Healthcare Leaders to Success. I've had people in the Center for Executive Coaching ask me for 2 decades now to create a healthcare leadership coach certification program, and I'm just delighted to have finally launched it. And today's really the inaugural day where I want to share with you 3 case studies of coaching healthcare leaders to success and talk about the opportunity in healthcare. Personally, it couldn't come at a more important time. I have a really close family member who's in ICU right now, as I imagine many of you do with all that's going on. He's at an academic medical center, and the care is so fragmented and challenging that his wife has called a meeting Mayo Clinic style to bring all the caregivers together, just to have them coordinate. Apparently, processes are so fragmented in healthcare systems that even getting physicians and clinicians in general involved in coordinating care with a single patient is really challenging, such that the spouse of somebody in the hospital has to organize a call like a like a case manager would, or like they are known for doing at the Mayo Clinic. And so for me personally, this couldn't come at a better time either. So let me take you through what we're going to work on today. First of all, just some brief introductions. From there, I want to talk about 3 reasons healthcare is a mess and why this is a perfect time for you to coach healthcare leaders if you're not already. I'm going to take you through 3 cases. Case 1 will be a case of the overwhelmed and exhausted CEO of a health system. You could replace CEO with just about any leadership title or middle manager or frontline title in a healthcare system. So that'll be an applicable case. Case 2, grooming the next vice president of patient care. From there, we'll take a brief hiatus. I want to share with you the opportunity for you. Again, this is the inaugural launching of our healthcare leadership coach certification program. So I want to take just a few minutes for those of you who are interested to take a look at that. But please do stick around, because the final case is about one that happens and is happening in healthcare systems all over the place, the stalled change initiative. Okay, and then from there, we'll get to next steps. So brief introductions for those of you whom I haven't met. My name's Andrew Knightlick. I'm the founder of the Center for Executive Coaching. I've had a coaching practice for about 20 years, maybe a little bit more than that. I was originally a healthcare management consultant working with top healthcare systems and pharmaceutical companies on issues including performance improvement, clinical quality, and strategy. And that's where a lot of the methodologies that we use in the Center for Executive Coaching came about, although they've been adapted significantly to keep up with the times. I'm also the author of the book Coach, The Way to Coach Executives, Leaders, and Managers, Elegant Leadership, and a few guerrilla marketing books, including Guerrilla Marketing for Coaches. The Center for Executive Coaching is a leading ICF, or International Coach Federation, accredited coach training program, or ACTP. And in fact, if you're thinking more broadly about getting your certification as an executive coach so that you can coach in healthcare and beyond, I'd be absolutely delighted to speak with you after this webinar. We've had over 2,500 graduates, 32 countries around the world. What sets us apart is that we are known for practical, applied, client-focused, results-based, and proven coaching methodologies and tools. Okay, you're not going to get a lot of academic theory and discussion with us. You're not going to get a lot of pseudoscience, and certainly no fluff that you see in many other coach training programs. And as I already shared with you, because many of our approaches have their roots or their foundation in healthcare, we've attracted many healthcare leaders, clinicians, and professionals. The tools that we have work really well in the healthcare system, healthcare setting. So let's talk about 3 reasons healthcare is a mess. I think we could go on for hours and hours on this. I'm just, think of this as an appetizer. I think you all know that healthcare is a mess. And if I challenged you to come up with your 3 reasons why, they might be similar, they might be different, but I think this sets the tone. And I want to look at the external or macro factors, the organizational factors, and individual leadership. So first, let's look at what's going on externally. If I were going to boil it down on one page with only 3 bullets, I think this is what we see here. First of all, changing demographics, ever-growing consumer demand and expectations drive demand and seriously stresses capacity and supply. 2, without a doubt, the healthcare system is just so complex. It just makes anything difficult, whether it's change or just getting things done, right? There's fragmented processes and systems, so much so that, as I shared at the very beginning of this webinar, that the wife of the patient has to call a Zoom meeting of all the caregivers and clinicians involved to get them on the same page. And this is at supposedly one of the best hospitals in the world. So it's just hard to get things done. You have powerful stakeholders across the industry, all with good reasons to resist change. And that ranges from consumers to clinicians, pharmaceutical companies, unions, large healthcare systems, insurance companies, and employers. It's just really hard to make change systematically. Reimbursement is a puzzle. It squeezes margins. It's certainly bad for patient families. It's incomprehensible how to read a bill if you received a bill from a healthcare system lately. But the healthcare systems also face challenges with reimbursement because there's so many different plans that margins are hard to maintain. The labor market in healthcare, as I'm sure you know, is extremely challenging, whether it's because of generational differences, recruiting and keeping talent, unions, etc. Technology continues to advance, and it's costly, but not only costly, but there's overwhelming health systems as they adapt the new technologies and have to train their employees and clinicians to keep up. And then, of course, events like COVID-19 come around and push the system that was already at the brink to the next brink. And then what I see, at least in the United States, maybe worldwide, is you have politicization of healthcare. And so you have all of the politicians with their bumper sticker slogans about how to fix healthcare. And as we all know on this webinar, that leads to nothing but superficial solutions. And it keeps healthcare organizations constantly in a reactive mode because they have to react to policies that are piecemeal instead of systematic and thoughtful. That's just the external factors. Let's look at healthcare organizations. If you've worked within any kind of health system, I think you'll know that you see a lot of challenges, right? First of all, plant and facilities can be old and inflexible, right? One of the easiest ways to transform healthcare is by shifting the way that patients flow in and out of a system, in and out of a building, and many buildings just can't be changed. You have silos, organizational silos that make it difficult to communicate, right? I'm sure you're all familiar with that horseshoe approach to communication where someone wants to get something done quickly but has to go to their manager, their manager, their manager, then has authorization to go across to the other unit who has to go down and down, and it's very challenging to communicate. You have declining reimbursement and increasing costs. I've been doing this for 30 years now. I've had some involvement with healthcare, and it never changes. It's always, we're cut to the bone already. We always have to do more with less. Then you have multiple stakeholders and complex processes that make change a constant challenge. And have you noticed that the tools are always the same, but they always change the names and the language, right? There's Six Sigma, lean manufacturing long ago. What was it? Continuous improvement, total quality management. Yeah, they all are different, but are they different? And even still, even with these tools, it's hard to gain ground. One CEO told me, we have more than a dozen Six Sigma black belts who can analyze issues to the 5th decimal point, but still no one can get anything done. So we've covered the macro, we've covered the organizational, and then we get to the individual leadership level. And there's a few things here. Let me start with a riddle though. If you were to take 2 absolutely identical healthcare organizations, all facing the same challenges, and one succeeds and one doesn't, what do you think the difference is? What's the difference? You can type it into the chat if you like. And in the meantime, look what's going on at the individual leadership level. You have healthcare administrators with deep clinical and academic knowledge and credentials, right? But they still don't have as much exposure as they could to the best practices in leadership, right? They're still administrators at heart, not necessarily leaders. You have a revolving door at the top, right? The average tenure of a C-suite executive in healthcare in many systems is about 2.5 years. And often that's without adequate internal leadership development and succession planning throughout the organization. Unit managers, and here, for instance, an inpatient, the nurse manager, to me, is the backbone of any healthcare system. And yet they rarely get enough professional development for their unit success, or to reduce variability across different units, right? If you look at any healthcare system, you'll see a lot of variability, and often it's because the unit managers don't have the training and development that they need. And I'm not even going to mention burnout, right? Burnout among not just physicians, but nurses, managers, frontline workers. And yes, as I think you've all mentioned, the difference is leadership. That's the X factor. You have two identical organizations. Why does one succeed and one doesn't? Leadership. It just comes down to leadership, no matter how difficult the times are. And that, to me, is why this is a perfect time to be coaching healthcare leaders at all levels, right? They're overwhelmed. They have extremely difficult decisions to make. There's no doubt that they can benefit from a safe, objective sounding board, right? Whether you have clinical background or not, just being there as a safe, objective sounding board with the skills to listen and ask great questions can make a difference. And just about everybody in healthcare now needs someone who can help them cope, just cope, adapt as needed, develop a vision, mobilize people, and make things happen. You can't be an administrator in healthcare anymore. You can't just shuffle the paper. You have to be a leader. It's a perfect time to coach healthcare leaders for those reasons. Okay, so let me give you 3 examples. Again, we'll start with 2. Then I'm going to talk a little bit about the program that we're launching, the Healthcare Leadership Coach Certification Program. And then please stick around for the Change Leadership case study because that's one that I've done a lot of, and there's a huge opportunity there because everything continues to change. So first, let's talk about the overwhelmed and exhausted CEO. What I'm going to do in each of these cases is give you an overview of the situation and talk about how we handled it. By we, in these cases, these were my clients. So here you have a CEO of a healthcare system that's been working so long, so hard, that his own health has been suffering. Okay, so we're talking 3 hours of sleep some nights and signs of deteriorating physical health, according to his physician. No life outside of work, and even at home with family, he's on email all the time, not sleeping, doing work. And his staff loves him. He has a great leadership team that expresses concern and says, look, this is not sustainable. We have to fix this. So the coaching goal here was to work with the CEO to find ways to regain a healthy balance at work, no more than 12 hours per weekday and a few hours on Saturday. And if you know anything about healthcare, that's a pretty extraordinary work-life flow for a CEO of a busy health system. Okay, so think about how you would approach this assignment. I want to share with you a little bit about how we did it. First, I always assess. I hope if you're a coach, you always assess. Should you join the program, we'll talk about assessing clients and using data to figure out what's really going on. In this case, we used an off-the-shelf assessment. I'm partial to something called the Profile XT, which is really good at understanding behavioral traits, thinking styles, and interests. But what really cracked this here was a time study. As busy as the CEO was, I insisted on the CEO making more time to track how he was spending his time currently. If you're going to deal with overwhelm, especially related to time and priorities, it's critical to get data. Otherwise, people's memories aren't that great. And some of the things we found, and again, there's a whole spreadsheet as we track time. That was really remarkable. But first, the CEO was driving from site to site across the region. And because he was driving, he couldn't get any work done. That killed a lot of time. He had so many meetings, right? Like how busy was he, if this was stand-up comedy, that both he and his executive assistant were double booked, which of course throws into question how good that executive assistant was in the first place. And as another thing we did was map out an org chart of a traditional health system. And I said to the CEO, I want you to put your name in all of these boxes where you have a role. right? Not just the CEO box. And it turned out that he was doing the work of multiple executives. He was doing strategy, payer relations, and negotiation. There was an innovation center in this system that he was very involved in. He was leading a performance improvement initiative. He was doing mergers and acquisitions to develop the system, and he was trying to create a managed care component, as many healthcare systems have or are trying to do. Now, of course, the CEO would have their hands in this, but this CEO was, I think, doing the work of actual people here. Also, we discovered that a perfectionist mentality that he had led to spending too much time on tiny details rather than focusing on, no more than 3 strategic priorities or using the 80-20 rule. Okay, and as I said, we drew the current org chart not as it is, but based on roles, and found out, again, that the CEO was in many roles that the organization hadn't staffed. In other words, this system, I mean, this was a multi-billion-dollar system, tens of thousands of employees. It was basically being run like a giant mom and pop organization with one main leader and thousands of employees. I mean, you could imagine it almost looks like an insect with a big giant body and a tiny little ganglia or brain. So that was what we discovered when we started the coaching. And so our coaching plan was threefold. First, design the ideal or at least the best possible use of time for the CEO. The CEO would do this, wearing only the hat of a true CEO, right? What's a true CEO do? Set direction, create the culture, recruit and develop top talent or a top team, and make key strategic decisions. That's really what a great CEO does. And then second, identify uses of time that were not appropriate for the CEO role, could be delegated, didn't need to be done, and didn't need to be done perfectly. In other words, we went through every task that the CEO had tracked in their time study, and we used a highlighter. Actually, we did this in Excel, so we could highlight things in Excel that check those boxes of things the CEO doesn't need to do. And then our coaching sessions basically focused on making all of this happen, right? Setting boundaries, influencing the team and the board, shifting perceptions about perfection and being in control, adding people to the executive team, and creating new behaviors and habits in order to get things done in the day at hand, okay? And, for those of you who are in the Center for Executive Coaching, we're famous for our methodologies and solutions. So areas of inquiry that we hit on as a coach were handling overwhelm and priorities management, of course, setting boundaries, getting organizational leverage for the leader, shifting perceptions, right? Because this leader had a perfectionist perception that could be reframed. We used a behavioral coaching methodology to identify a couple of key behaviors to make a habit. We did some strategy work too. This was a system that probably had 25 strategic priorities. And I don't know about you, but my experience is an organization doesn't do well with more than 3, maybe 5. And then we looked at changing the culture as well, once we got the CEO's time under control. Okay, so here's the actions that happened, then the results, and then we'll move to the next case. All right, and by the way, I see a question, can anyone with management experience do this course, or do you need formal coaching experience? So what's interesting here is, I think in healthcare, it's important to have credibility so that your clients respect you. Now, I have no clinical background, but I do have healthcare experience, and coaching skills are really important. You really want to know how to coach, because it's up to, in this case, the CEO had to say what the CEO would do. We, you, me, anybody on this webinar would know the answer because we don't have this problem and we're outsiders. It was the CEO who had to come to terms with the situation and make decisions. And what the CEO did was, 1, create a new org chart with 5 new executive roles and hire for those roles. As a perfectionist, this CEO had a belief, no one can do it as well as I can. I don't know if I trust other people. And we worked through that. And this was made a massive change. The CEO went to the board to hire a driver so he could do work during all of this driving from site to site. We worked on delegating more decision-making authority to the team. And again, as a coach, it's really easy. Let's list all the things you're doing. What can you delegate? What conversation do you need to delegate? To whom? What expectations do you have to set? And we had the CEO significantly reduce the number of meetings that he attended. If any of you have been in any healthcare system other than perhaps a military hospital environment, you'll know that meetings are ridiculous. And something fascinating happened at this system. The CEO reported to me. He said, Andrew, here's what happens. I'm in a meeting and I can see the door with the glass window. And I see people go by whenever I'm in a meeting and look in the glass window. And if they see me there, I know they're going to contact me afterwards because they're insulted because they weren't invited to the meeting. It's like I have to go to every meeting to bless it and make it real. It's phenomenal. This idea of status, especially in nonprofit healthcare systems, had reached that point where if the CEO wasn't at a meeting, partly because of the CEO's own behaviors of making all the decisions, people didn't think it was a real meeting. So the result, it worked. I think just, adding 5 roles, which seems obvious as you hear this, but to this CEO and his executive team was not apparent until we drew out the org chart of all the things the CEO was doing and worked on some issues with perfection, delegation, and trust. But he got his life and health back, and the organization accelerated the change initiative it was working on. So this is just one example of the power of coaching. Okay, let me give you a second example. Maybe we'll take a break there, take some questions. And then I want to introduce you to this healthcare leadership coach certification program, if you're interested, and then we'll move to what to me is a bread and butter of my practice, change, coaching on change. So here was an interesting case, grooming the next vice president of patient care. Now, this is a big deal. Again, you can replace vice president of patient care with almost any executive role or leadership role. There's not, in many health systems, there's a struggle to groom that next position. And so they often hire from outside. And I think you know that that's not always the best choice. So in this health system, what we had was a director of nursing who was identified as an internal candidate to replace the vice president of patient care who was retiring. Functionally, technically, in other words, this director of nursing was phenomenal, outstanding. She was also great with her employees. She had the highest engagement scores in the system. However, senior leadership and the board were concerned that she lacked what we'll call executive presence. The executive presence required to move into the vice president of patient care role. Sometimes that's, chief nursing officer, sometimes that's called. At this place, it was called vice president of patient care. So the coaching goal was develop executive presence. We don't know what that is yet, right? That's a pretty vague term, but develop a level of executive presence to earn the trust and credibility to move up into that role. And again, think about how you'd approach it. I'll share with you how I did it. So first, once again, did an assessment to understand her thinking style and behavioral traits. If you get into coaching, you really want to have a great off-the-shelf assessment that's highly validated, that helps you get fast insights about the client to move forward. And I did a 360-degree verbal assessment to understand her impact up, down, and across the organization. Now on this engagement, I teamed up with a retired vice president of patient care. And so the two of us really worked well together. This was especially the case too. I mean, part of this was a little bit of intimidation perhaps with a male-oriented culture, at least at the top, right? Healthcare organizations, healthcare delivery systems anyway, are really strange in that 75% of the employees are women, and yet at the leadership level, you see mostly men. And in fact, I would always call this the hall of white men when I would walk down almost any healthcare system I worked in. You see all these photos of past board members, board chairs, leadership team, and it's really intimidating. And so we were a good team because I could represent the male point of view, my colleague could represent the female point of view, and of course she was a very successful nurse executive as well. So what we found when we did our assessment was, first, there was a big time management issue. And primarily this was related to her wanting to be what she called the mother hen. That is, if an employee had a problem, that employee could walk into her office anytime unannounced, right? The classic open door policy, But what would happen is it might turn into a 3-hour meeting where the employee just dumped all his or her problems into her lap, and it became like a marathon venting session. I don't think that's how executives handle that kind of thing, but that's what was going on. By the way, another great thing about coaching in healthcare is that leadership or management practices that we would take for granted in any other system, right? You wouldn't see this in any other place, but healthcare, we can really bring these amazing insights to our clients in healthcare because they still perhaps haven't exactly caught up to what best practice leadership and communication and time management behaviors are. So as a result, or related to time management, it was clear that she focused so much on building relationships that she sometimes didn't have the difficult conversations needed to get results. And thirdly, her body language, dress, relationship to time, and overall comportment was very, very informal. She called herself a hippie, basically, compared to the culture of the organization. Now, that's not necessarily an area I work in. And so again, that's why it was nice to have this collaboration with the former chief nursing officer. So the coaching plan. First, we planned out and role played new ways of engaging with employees. I mean, it really wasn't complicated. It was just any time an employee would come in with a problem, her job was to say, what do you think you should do? Or what are 2 alternatives and which one are you favoring? So that the conversations were shortened. And I'm telling you, this was hours and hours and hours per day. We also role played conversations that she was going to have or would have with senior leadership to help her adapt to their more formal style, right? And that, again, is a great advantage to starting with some assessments up front so we can learn our client's communication style. We practice public speaking exercises to demonstrate body language, voice tone, while still being authentic, but having that executive presence, standing straight, making eye contact, not going all over the place frenetically with the hands. We also had to do some perceptual work. You'll notice, again, a lot of perceptual work in healthcare. The last case had it. In this case, it was a perception about I am my role. And so we had to let her know, no, you're not your role. Your identity and your role are 2 different things. And then one of the best methodologies, or my favorite methodologies in the Center for Executive Coaching is we have a number of tools and methods and processes about strengthening relationships with key people in the organization. So in this case, we developed a relationship plan for her with the key leaders in the organization. How can she get more visible? How can she show that she's credible? How can she develop relationships with them? At the same time, we couldn't leave a leadership gap for her role. We had to have her groom a possible successor to backfill her current role. So a lot of this was developing leaders. She had done a lot of, I guess there was sort of a dependency between her and her employees. So once that was broken, we had to have her start developing successors. And again, as I said, I worked with a chief nursing officer that worked with her on image, dress, and grooming. She was really good at that stuff. That is not an area that anyone hires me for. And so consider that in your own practice, having alliances. So here, areas of inquiry. And again, many of these tap into our approaches at the Center for Executive Coaching. Role playing, strengthening relationships up, down, and across the organization, improving communication impact and flexibility, shifting perceptions from unhelpful ones, that is, I am my role, to more productive ones, changing of just a few key behaviors to project greater presence, developing leaders, and engaging her team differently. We have a wonderful approach to engaging employees. So the results, they were good. She maintained the same results while working fewer hours. In fact, results got better. And just that one act of when someone came into her office, setting that boundary of, well, what is your solution to the problem? Saved her hours and hours, and also started developing the team and identifying for her who might be a good leader on her team. She also did shift her perception. It took a while, but she realized I can step into this role because it's just a role. It doesn't change who I am. Again, she saw herself as a laid back hippie and not, I'm not joining this corporate thing. And she realized, look, this is a role. I love it here. We tapped into what really mattered to her. And so she earned the trust of the senior leadership to move into her role. Okay. So there's two cases. In a minute, I want to talk about the opportunity for you, talk about our program, and then get back to change leadership. But this might be a good place to pause. I'd love to hear any questions you have at this point. I'll do my best to answer them. One is, how many sessions did it take to achieve positive results? My typical engagement is 6 months. I don't like 3 months. That's typically not enough. And the market, what I'm seeing is 9 months to a year. I tend to be more of a bottom line, laser focused type of coach. So what I do is start with 6 months, and then we renew if necessary. But in both of these cases, 6 months was more than enough, especially with a good solid assessment up front to understand the issue and start moving into action. Does one need to have a background in healthcare to be effective in this space? I think not necessarily. You certainly don't have to be a clinician. Any background in healthcare you have helps. You need something to be credible. Again, you need something to be credible. In healthcare especially, it's a fairly status-oriented, credential-happy industry. Okay. One asked, did I meet every week? Yes, we met every week. Now, this was before COVID, of course. In today's environment, and before Zoom, and in fact, I think Skype was just in its infancy. And so, a lot of my work is typically, I get, at least traditionally, is that I would come into a client every quarter and do most of my work by phone or by video, if necessary. Okay, now with this client, a lot more had to be done in person because we had to practice presentations. But even today, I can do presentation training very effectively on Zoom or Skype or any of those platforms. Question, any assessments I use other than the Profile XT? Yeah, so I use the Profile XT. Any assessment can help here. Any assessment that is highly validated, very reliable, can work. The Profile XT for me is great. It helps me understand someone's thinking and communication styles. It has 10 different behavioral traits that I can look at, things like sociability, pace or energy level, independence, manageability. I find it to be very, very good in a healthcare setting. I also now use, I didn't at this time, it didn't exist, I use the Genos emotional intelligence assessment, which is great, especially when working with physicians or clinical or technical people who might not have all of the competencies required to really connect with people. Okay. A question here, have I noticed that healthcare leaders tend to shy away from things like coaching because they're pulled into urgent situations? Yes, and guess what? I coach in a variety of industries. I've noticed this everywhere, right? When it comes to looking in the mirror, pointing the finger at ourselves, being vulnerable, often we'll come up with excuses and say, not now, something came up. And so what the effective coach does is stay on equal footing with the client and calls that out, especially if it becomes a pattern. Says, look, how important is this to you? We have to set boundaries too as the coach, while also being flexible, especially in today's setting when there are multiple emergencies happening quite frequently. Okay, all right, I think that's a good start here. Keep posting any comments or questions you have. So already, I hope you see there's a big opportunity in healthcare leadership coaching. I think in terms of niches right now, this is one where I'm seeing continued interest and growth, even with all that's going on in the world. So I want to share with you, how do you set yourself apart as a certified healthcare leadership coach? That's the program we're launching today. And I hope if you see a fit, you'll join. I want to share with you a little bit about the program and give you a sneak peek of the member area. I'm not going to take a long time to do this. What I want to then do is get into our third case, which is the stalled change initiative. Okay. So this has been 2 decades in the making, and I've been prodded and challenged by so many fellow coaches and colleagues to start this. There's really nothing like this. There are academic institutions that have healthcare coaching initiatives. This is something different. The goal here is to create a supportive cohort of the top healthcare coaching professionals, right? And we can help you become that. But by top, I mean, I'm not trying to be huge. I don't need this to be huge. I just want the best people involved to enable success, success for clients, success for the coach. A little bit of this philosophy, by the way, is from a guy named Nick Bollettieri, who started a famous tennis academy. You might have read about him if you read Andre Agassi's autobiography, who, he didn't necessarily speak highly of Nick. But what Nick did that was genius was he drove around the country and he found the top tennis players in the country at the time, and he just brought them together and just had them play tennis together because he knew that would make them much, much better. That's part of the mission here, is a supportive cohort of the top healthcare coaching professionals in the field to enable success. And I want for us to become the standard for coaching, not theoretically, not academically, but for coaching that makes a significant applied difference to everyone involved in the healthcare industry. And essentially for you, the mission is, if you join, I want to give you an unfair advantage as the go-to expert in the healthcare coaching and leadership development space. Right? That's the whole purpose of being here and launching this initiative. So the opportunity is to make a massive difference in an industry that, as you've seen and as you already know, desperately needs the kind of support that leadership coaches can offer. It's to equip yourself with processes and methods to address the specific challenges that healthcare leaders face and stand out, essentially get an unfair advantage. You'll also join an exclusive network of top professionals for sharing ideas, supporting one another, forming alliances, all to serve clients. If you're an external coach, it's going to either equip you or add or refresh your toolkit with the processes and methods needed to set yourself apart and serve clients in the healthcare space. If you happen to be internal as a coach, a leader, a manager, you'll be able to use this program to have measurable impact on your organization's strategic initiatives, performance, and culture, and your own career. And you'll also be able to create a culture of success through coaching, which is really powerful. So let me share with you what's included. I'll give you a sneak peek, and then we'll get back to the content. So I've created processes and methodologies specific for coaching healthcare leaders through their most important challenges. Okay, as soon as you join, you'll have these in your member area. You can put them to work for you instantly. They include grooming a new patient care executive, supporting the new physician administrator to succeed in a new role. That's huge. In my family, I have 3 physicians. All 3 of them are already transitioning out of healthcare, at least direct practice, and into healthcare administration. They need a lot of support. They don't have traditional leadership training. Help leaders of a stalled change initiative get on track. And again, I'll share with you a case study in a moment. It's not the methodology, but it's a case study. Coaching to support a performance improvement initiative to succeed. Again, that's huge. There's tons of people in healthcare systems with black belts in Six Sigma. They can analyze things all over the place, present reports, but still nothing gets done. That's where the coach can be invaluable. One of the most popular ones now is enabling the disruptive physician to have more effective behaviors, whether they're practicing directly or they've switched over to admin and brought some of their behaviors from the surgical suite over to their teams. That's a really nice big area of coaching. Coaching a leader to achieve their goal in a high stakes influence conversation, right? A good leader gets results while maintaining or strengthening relationships and keeping their ego in check. We can coach leaders to have that high stakes conversation. There's many all the time in healthcare. It's critical to get things done. Coaching to resolve conflict, coaching to improve employee engagement. In fact, one of the methodologies has been tested already at 2 systems and has been proven statistically to lead to an increase in employee engagement scores for those managers who were coached using this methodology. Handling overwhelm, juggling too many priorities like the exhausted CEO. There's a wonderful module on developing the nurse manager or a group of nurse managers through coaching. It includes a detailed nurse manager competency assessment. You don't need to be clinical to administer it. You can work with nurse managers and their teams to get insights. And to coach high potential leaders in a healthcare setting. In other words, to develop people, to develop high potential leaders, something where healthcare systems definitely are starting to realize they need to do more of. So that's just part of what's included. You're going to join a cohort of top professionals, and we're going to meet monthly. We're going to have monthly live 90-minute mastermind group meetings. They'll be virtual. They'll be recorded if you can't make the time. And during those, we're going to do a lot of things. You're going to guide the content. I'm going to survey you to see what you want to do. But certainly, I imagine it will include going deeper on some of the content in your program, discussing case studies, forming alliances, and supporting one another. We already have cases lined up. We have a group of 4 who have done some amazing research on physician burnout and how to use coaching to prevent and handle physician burnout. So they'll be presenting. We have another member who has created a coaching program for clinical faculty for career development and development of emotional intelligence. And so she'll present. And there are many others. Again, we have a really nice cohort already in the Center for Executive Coaching of people doing great things in healthcare. You'll also have the opportunity to meet in smaller groups like triads, groups of 3 for networking and support. I'll break you into those groups. You can contact me anytime for questions and support. So if you have a real-time coaching situation, you basically have a help desk, and it's not a bad help desk to have. There's a slide deck with 360 slides with all of the different methodologies in the program, and you'll get certified as a certified healthcare leadership coach with the Center for Executive Coaching. So there's a lot of great stuff included. I want to take you to the member area just so you see what you're actually getting, okay? So let me get to that. Let's see. This is the actual program. Hopefully you can see this member area. Someone let me know if you do not. You don't have to say if you do, but if you don't see the member area, let me know. There's really 2 components to what you're going to get. First, as a bonus, we have a whole set of content about attracting clients. This works for you as an external coach, but if you're internal as a coach, you might need this as well. Okay, and so just for example, there's a series of animated videos. And these are about 5 minutes each. It's like micro learning on what it really takes to develop a practice, starting with the psychology of business development, what it means to choose a niche, how to create great messaging, how to use your time effectively to attract clients, different ways to get visible, how to price, how to propose. We have sample proposals. And recently we created a whole program of 6 webinars, how to create online programs. There's 6 webinars here about how to do that. Of course, the world is changing to more online. So we show you how to do that, and you'd get support to do that as well. And then business development with an online focus. So there's tons of content, including sample marketing messages, sample sales questions, and we've had 2 previous calls before, or cycles of webinars on this before, all recorded, all ready to go. And with the program, you get as much support as you need. I'll review your marketing message. I'll review your strategy to get visible. At the same time, the second tab is the Healthcare Leadership Coach Program. So I just want to walk you through it. First of all, there's the written resources include the Healthcare Coaching Deck, 360 slides. And you'll get our proprietary textbook with the Center for Executive Coaching. It's 423 pages. You can download it. If you want a hard copy, I'm happy to mail you one. And look, if these written resources aren't enough, we have an incredible vault of materials within the Center for Executive Coaching I'm happy to help you with. From there, we move to Coaching Defined and the Foundational Coaching Conversation, as well as Active Inquiry, which is the Foundational Coaching Conversation. There's over 6 hours of content here that you can go through to really learn the fundamentals of coaching. Okay, and so you'll see each of these sections is set up so there's already a webinar there. It takes you through Coaching Defined on this section, for instance, Foundational Coaching Conversations, Coaching Conversation Assessment, and then each video has a transcript that's ready to go, okay? Then we get to the coaching process. How do you set up a coaching process effectively in healthcare? The orientations of the coach, using assessment data in healthcare leadership coaching, where I'll give you some case studies of how to use data. How to create a development plan when you're coaching healthcare leaders and managers. We have a tool called the Leadership Dashboard that is wonderful for healthcare leaders to get focused and grounded. You've already seen a little bit about coaching the overwhelmed and exhausted healthcare leader, the VP of patient care, coaching the new physician leader, coaching the disruptive physician. Let's go to that one for a minute. Just so you see what you get, each one has a slide deck. In this case, there's 50 minutes of instruction. There's the full, there's things to look at in our proprietary textbook that you might also use. So you basically have a whole turnkey program to work with the leader. And then we have the transcript as well. And you can see it goes quite a while for those who would prefer to read. Okay, so what else do we have? We have coaching healthcare leaders on high stakes one-on-one influence conversations, coaching to resolve unproductive conflict in healthcare organizations, whether it's your client who has a conflict or your client who's allowing and tolerating a culture of conflict. There's a whole section on engaging employees. As I said, this is very powerful and proven statistically to improve engagement. There's a whole set of modules about change leadership, performance improvement coaching. That's my background, by the way. And so the tools here have been tested in the field and continuously updated. There's a section on coaching the nurse manager and coaching high potential managers and leaders. Okay, a good question here. Are healthcare coaches generally hired by the executives themselves or the organization? In my experience, it varies. And within the organization, I personally like to go to the executives in the C-suite. Sometimes you can go through human resources, but often there are a number of coaches I've worked with who get hired directly, for instance, by physicians in some states could lose their privileges if they're disruptive. And so they will pay out of pocket. I've had others who pay out of pocket. So it really depends. And you'll see in our attract client sections how things, how different ways to make it work. Okay, so briefly, let me just show you how to register if you're interested, and then let's do the final case. You basically go to our website here, Center for Executive Coaching. Under Get Certified, you'll see the Healthcare Leadership Coach Training and Certification Program, and it's here, centerforexecutivecoaching.com. In fact, if you don't mind, come here with me, and I'll type it. I just typed it into the chat if you want to visit with me. And you can scroll down and we'll just share with you everything that's included. There's a shorter video that takes you through it again. And by the way, I see some questions like, is there a module on this or that? That's part of what we're going to do as a cohort. Okay, if someone has experience in an area, I want them to present. If there's something you don't see and I've had experience in it, I'll present on it. We're going to poll our members. Think of this in a way, it's almost like a virtual firm that we're creating of top professionals to make a difference in healthcare. Anyway, on this page, you'll see, here's the benefits, here's the advantages, a review of what you'll receive, and the tuition. The tuition, if you pay up front, is $2,450. That is, it's $2,500, 5 installments of $500. This tuition will be $4,500 after we fill our inaugural class. Okay? So if you want to register, you should. It walks you through the certification process. You have 2 options for certification. One is you can write up a case study of how you will use these tools to coach your organization or an organization to success. Maybe it's a case study you've already done. Or if you're newer to coaching, my preference is that you submit 3 recordings of you coaching a healthcare leader about a significant leadership issue they face. By the way, we already have a group of physicians who are meeting and coaching each other and practicing coaching. All right, as soon as you join, you get access to the member area, you start, and so on. Okay, so in a nutshell, that's the program. Let me get to the 3rd case, and then stick around though. I'm going to share with you, I have like 3 bonuses. You've already seen them in a way, but I want to make sure we make those clear. Here it is. For the first 25 who join, right? And again, let me input this. So the cohort's going to start within about 30 days of this webinar. I want to give everyone time to absorb the materials. And the cohort meetings are recorded. And remember, you also meet in smaller groups live if you wish, and I'll organize that. Again, I'm not looking for this to be a massive program. I just want high quality professionals. The first 25 who join get the following. You get the Attract Clients tab that I just shared with you. Okay, that's our unmatched, it's really step-by-step guidance, templates, and support to build a practice. You can also reach out to me anytime with questions. You'll get our proprietary 423-page textbook. I'm happy to mail it to you. And I'd like to set up a 30-minute strategy session with you if you're open to that and if you think that would be valuable anytime to talk about your practice, any issues you have with coaching clients, or building the practice to where you want it to get. Okay, people pay me a pretty good dollar to coach them, and so I'm delighted to offer this just to the first 25 who join. Okay, and again, you can see the URL right on the screen there. For any individual questions that you might have, by the way, just reach out. Just shoot me an email. I'll share that with you at the end. I want to get to the last case, though, and leave time for questions, if that's okay with you. All right. Yeah, the first 25 include anybody who's already signed up as well. Okay. So one of the engagements that seems to have been a bread and butter for me for many, many years is the stall change initiative. I mean, anyone who has any experience with healthcare, I think you might be rolling your eyes or smiling at this point, because you know that making change happen in healthcare is really hard. You could make an entire practice based on this one issue in healthcare if you wanted to. And so here, this was a relatively new leadership team, an executive team of 5. There was a leadership team of 15. But the team of 5 was frustrated with a change initiative that had stalled. And this was a critical change initiative, critical for the health system, for the system to continue to survive, let alone compete, right? There's a lot of existential issues going on for health systems right now. This change initiative had to do with getting bigger, building scale and operational efficiency, patient satisfaction, physician satisfaction, employee engagement, reputation in the market. I mean, it was really massive, very challenging. And the CEO and executive team reported numerous issues with what was going on. First of all, the system was somewhat merged, and so there were issues with legacy employees versus one group over another. Skills, some of the skills just didn't exist to make change happen, to communicate, to influence, to make a business case. Resistance among medical staff, culture, and just willingness to go at a certain pace that was required just for survival. Those were just some of the issues. Type in if you if this is familiar to you. Okay. And so during our assessment, first of all, I assessed the team, the executive team of 5, just to understand their thinking styles and behavioral traits. And it was really enlightening to see how different they were. And I interviewed the executive and the leadership team about what was working and what wasn't working, what was causing issues with the change initiative, right? Real simple assessment. The findings were the following. First, 2 members of the medical staff in particular were causing bottlenecks. In other words, ideas would come to them and they would just say no. I don't know if they were consolidating power, if they were just conservative, whatever it was. There were just these, I knew one wanted to, really rise through the ranks and take over and get on the board. So it might've been a power trip, who knows? Similarly, I found leaders and managers alike lacked the skills needed to get broad support for new ideas. They just didn't know how to get support. They knew what the idea was. They didn't know how to make a case for it, how to influence, how to do stakeholder management. At the same time, there were some rogue messages happening. Have you ever seen this in a complex organization? In other words, the CEO and team thought they were sending very clear messages. Those messages would get diluted as they trickled down the system, with some managers going rogue with their own interpretation of what the change initiative meant, right? That's never good news. We have the metaphor of the chocolate fountain. You know, those chocolate fountains that you see at weddings, and you want the chocolate to be pure and consistent at all levels. Well, that wasn't happening here. Also, employees reported the pace of change was just seen as way too fast, especially by employees who were at the system that could be considered to have been the one acquired. So a lot of issues going on here. So the coaching plan. First, group coaching with the executive team. We just meet and have open conversations about the issues and address them. Isn't that amazing? One of the things that happens in healthcare is there often isn't transparent, open, and honest communication. You as the coach have the opportunity to completely shift the quality of conversations. So we talked about different communication styles, different behavioral traits, so that the team understood each other and could build on their strengths and be more tolerant of differences, right? Often in meetings, we look at someone and say, wow, they're really annoying. Well, with data, now we know why they annoy us, and we can move away from nasty interpretations and just say, look, okay, I get it. I'm on this side of the scale. You're on that side. Let's figure out how to adapt. Just conversations become much more collegial. You'll also learn some note card exercises should you join the program. Really fun exercise. Give everyone an index card. They can write some thoughts about different things. One, they might write, what do you think the real issues are with the change initiative? And so I would collect those note cards, read them out, put them on a flip chart, and we would tackle each issue one at a time. Sounds obvious, but often again in health systems, people are afraid to speak out. That kind of very simple process can make a difference. And also we did some note card exercises that gave each leader instant feedback. What were they doing well? What was one thing they could do differently? At the same time, I did some individual coaching of leadership team members and managers to help them adapt the big picture change message to each unit. We actually did a facilitated session on that as well, where everybody came together and had to present their message. You know, the CEO said, here's the overall message for why this change is important. Each person then had to, for their unit, come back with their message to make sure messaging was consistent. A lot of coaching with the CEO about making difficult decisions, especially about the leaders who are actively resisting the change. And also just to give the CEO a space, a place to have a sounding board in a safe setting. I can't underestimate, or is it overestimate, underestimate, the value to executives these days of having a safe space to talk to someone like you is more than worth the price of coaching. There was some coaching of team leaders about how to develop ideas and how to influence, how to go to stakeholders. And in fact, our performance improvement module in your program has a number of tools to help people develop the case, communicate the case, and get buy-in for the case, or report back when buy-in doesn't happen so that obstacles can be cleared. And then also training and coaching for managers to better engage their employees, because in this change initiative, everybody was burning out. Engagement was a big deal. Okay, so that was the coaching plan. Areas of inquiry were multiple, but basically a lot about change, building a team that's on the same page, improving performance and executing, a lot of role playing. It's really remarkable how people making hundreds of thousands of dollars responsible for the healthcare of their community don't know how to have an influence conversation or a high stakes conversation. You can make a massive difference there. Handling conflict. Again, we have a whole resolve conflict process. Engaging employees, shifting perceptions, especially just about seeing possibility and remaining positive and moving forward, right? If leadership can't do that, how can the rest of the organization? I continued working with them. Longer term, we created a leadership academy for nurse managers and coached some nurse managers and continued to work on improving the employee engagement scores. So this was a really nice engagement. This is a massive opportunity in healthcare. A lot of people, there's a lot of energy about physician burnout. For me, this is the area I really like, as well as working with high potentials to help develop them in healthcare. It's one of the few industries where there's not enough investment made, although people are realizing the importance of making that investment in high potentials. Okay, so as a result, the CEO, first of all, made some tough decisions. This was a CEO who didn't necessarily like to assert your classic administrator versus leader. Well, he made some tough decisions for him to reduce the roles of leaders who were acting like bottlenecks. Employees reported a clearer understanding of the change initiative and why it was critical. And leadership, and especially managers, got much better at developing ideas. In other words, they used the Six Sigma black belts for analysis, but they learned how to present ideas, get buy-in, and be accountable for execution. And employee engagement scores improved significantly. Okay. So here's next steps. Okay, I want to take some time to take any questions you have about healthcare coaching or the program. For those of you listening to the recording, I'm going to pause the recording after this part, but reach out anytime with any questions you have about the program. But essentially, I'm inviting you to register now and get access to all of this materials. You can see my cell phone number here, 941-539-9623. I really pride myself on accessibility. I'm running a boutique program. I'm not trying to be the biggest. So reach out. If you get voicemail, I'll reach back to you. You can also email me, info@centerforexecutivecoaching.com. And once you're in the program, just start reviewing the content. We're going to get the cohort meetings started. You have ongoing 24/7 access. You'll get those monthly meetings. We'll start those up. Again, you don't have to join those. They'll be recorded. They're there for you, and we'll also still give you the opportunity to meet in smaller groups, which I think will be quite valuable for you. Okay, so that's what's there. By the way, again, just the middle box, if you do have questions that are unique to you and you just want to set up a meeting to talk about whether this is a fit for you, send an email. Let's start with an email. Let me know some good times. I'm delighted to talk. If you think the broader opportunity of being a certified executive coach in healthcare, but throughout, maybe you want an International Coach Federation accreditation. If you think that might be something that's appropriate, reach out for that as well. We always have seminars, whether in person or via Zoom, and you can start that program anytime as well. Okay. So with that, I want to thank anyone listening to the recording and anyone who's here for taking the time to be here. I'm going to stop the recording and I'll hang out to answer as many questions as you have.